And thank you so much for joining us for the very first webinar being hosted by the Caribbean Coalition for Maternal and Reproductive Health, or CCMRH. My name is Aaliyah, and I'm a co-founder of CCMRH. And I'm also joined by Khalida, the other co-founder, if you wanted to say hello.
Hi, nice to meet you, everybody.
So thank you all for joining us. We are a program of the Kenneth Sterile Valley Foundation based in Trinidad and Tobago, which provides mentorship and community service opportunities rooted in the mantra of progress through service. CCMRH is a regional network that seeks to provide resources and support around maternal and reproductive health across the Caribbean region. Our coalition currently consists of member organizations in Trinidad and Tobago, Jamaica, Antigua, and Haiti, and some of them are joining us here tonight, which is really exciting. Through CCMRH, we seek to meet people where they are by providing resources and connections and a space to come together like this to share in community. We are so happy that you could join us today. And if you'd like to learn more about CCMRH or join the coalition representing your organization, please visit our website, www.ccmrh.org, or our socials at Caribbean CMRH.
Hi, nice to meet you, everybody. My name is Khalida, and I'm the other co-founder, as I said before. Today's event focuses on pregnancy and birthing experiences during the pandemic, and it's split into two sections. So the first section will focus on the experiences of women who were pregnant or gave birth during the pandemic. Tonight, we are lucky to be joined by Janine Newton from Trinidad and Tobago, Nikisha Foster Biggs from Jamaica, and Laura Lydia Jordan from St. Lucia, who will share their stories with us tonight. We are also joined by Yashi Carrington, who will moderate this discussion. The second part of the webinar will be led by Deborah Lewis, a midwife, who will provide tips and strategies for those who are pregnant or have recently given birth during the pandemic. We are so thankful to be joined by our panelists, our moderator and presenter for today's presentation. Before we begin, I would like to note that this webinar is being recorded and will be shared on our website and social media following this event. And also, please remain on mute during the panelist discussion and presentation. And if you have any questions or comments, please type them in the chat. There will also be a Q&A period at the end of the webinar. So you will submit your questions using the chat function, but you can also use the raise hand function, and then you can unmute during the Q&A session if you would like to ask your questions verbally. If you prefer, you could also send your question to Yashi or Aaliyah or me directly, and we can have it asked live for you. And then just to note, the information provided in this webinar is general. So if you have any specific concerns or needs, always contact your health provider directly. And thank you again for joining us tonight. And we will now pass it over to Yashi to moderate the discussion.
Hi, good evening, everyone. And again, thank you so much for joining us this evening. And thank you to Aaliyah and Khalida for putting this together, and to CCMRH for, really taking that lead to really try to help persons in the Caribbean really get the resources and the information needed for different topics when it comes to maternal and reproductive health. And of course, one of the things we all know, pregnancy in itself is a beautiful process, but it can have its complexities. And if you are like me during the pandemic and you're wondering, how are moms really coping, because motherhood in itself has some challenges. While it is a great experience and you really grow as a mom through those experiences, what is that like during a pandemic? So I'm really glad that we have some moms here, some persons who have had the experience and also who have had the expertise to be able to share their experience and then share their insights to really help moms, who may be pregnant right now, who are thinking about it, where to know, what they can expect, where they can get help, and how they can support each other. So to kick things off, we're going to start right away into the discussion, and we're going to talk first about the whole pregnancy experience. So what I want to ask the lovely ladies tonight, the moms here with us tonight, did you have a birth plan, and how did it work in practice given the pandemic? So Laura, if you would like to go first, you could just share a little bit about that.
Hi, good night, everyone. Yes, I did have a birth plan. It was to have a C-section from the onset for the second pregnancy, because my first pregnancy I had some complications when I tried to do the natural, so I had to go into emergency C-section. So I just decided up front for the second time around, I'm not going through all of that again, so let's just do the C-section. But the whole process was different in that you had to prepare for just getting into the hospital, getting into the operating room. They had to ensure that you did not have COVID. And yeah, so you had to be tested 3 days before, and they had to receive the test and then call you to tell you that, okay, you could come into the hospital now to register and everything. So even if you had everything laid out, you still couldn't just go in because it was planned. If it was perhaps an emergency situation, perhaps they may have let me come in, but because it was planned, I had to go through that. And that was, I hadn't had a COVID test prior to that month, but it so happened that I had gotten the cold, and so I had gotten the test done several times before, so at least I had that down. But yeah, I had to do the test, and thankfully I was negative, so they told me I could go ahead. Yeah.
Oh, wow. And just to clarify for the persons on the call, so St. Laura is from St. Lucia, as I shared before. So Janine, if you could give a little bit in terms of your experience here in Trinidad, in terms of your birth plan and how it worked during the pandemic.
So yes, I also did have a birth plan, and it kind of mimicked the plan I had with my first son. So my first son, I would have delivered him before pre-COVID times, and then my second son was while at the beginning of the COVID-19 pandemic. The hospitals weren't really at the stage where they were testing you on admission, but however, it made me kind of look more into the options and what were the changes that certain institutions and the public hospitals were implementing at the time. And the biggest change really was not having your support person or my partner with me. So I had to kind of prepare myself and know that when I am going to deliver my son, that it would be myself, and I would have to be my own support person there at the point in time. So that is really how my birth plan changed, the differences that it had, and the type of preparation I had to do for the birth of my second son.
Oh, wow. I can't even imagine the thought process and mindset you have to build to be able to do that without your support partner. So Nikisha, kind of share with us your experience in Jamaica.
Well, similarly, I had a birth plan. The plan was when I found that I had symptoms of labor, I would go into the hospital. Unfortunately, that was not so because of certain high-risk conditions. I was supposed to go in to be induced. So I went to clinic Wednesday, was sent to hospital the Thursday to be induced, meaning, for those who don't know the term induced, they would start labor. Unfortunately, on being examined when I went in on the Friday, they said I would not be able to be induced. I would have to do a C-section. So my entire birth plan changed. So for the first child, I had a normal vaginal delivery. For this one, it would be a cesarean section. So I went into surgery, but everything was okay, thank God. So that's the difference.
You know, it's really making me think about this whole experience because for one, doing that in itself is a lot for a mom. But now as you guys are sharing in terms of Laura, you had to get the test. So now in the pandemic, these type of things you have to start considering, putting aside funds to be getting the test. Well, I guess depending on if there's a cost attached. Janine not having your support partner, the birth plan changing, not necessarily because of just the usual complications, but then also considering whatever complications a pandemic brings about it. So, ladies, what I want to ask next is what levels of support were you given during the pregnancy and birthing process? And from whom did you get that sort of source of support? So, Laura, you could go first.
Okay. It started, well, my husband, first of all, he was there with me throughout the entire process for both pregnancies. But on the second time around, just as Janine said, it was different in that you had to go in to see the doctor by yourself. Thankfully, that was my second pregnancy, so this was not like my first experience because that would have been really scary. I was accustomed to the doctor. I knew her. She operated on me the first time, so I had that level of trust. However, the hospital that she worked at, I could not deliver there, so I had to change to another doctor, but a well-known doctor, a doctor with a lot of experience. So that was at first a little scary. So my first visit, my pressure was actually a little higher because I guess I was a bit nervous. Yeah, because I'm meeting this person for the first time, and this is the person who is going to operate on me and take my baby, and I don't know you. So yeah, thankfully her office was a bit bigger. So I think the second time around she allowed my husband to come in to see the ultrasound and everything. But it was mainly the doctor, my husband, and my mom, on the phone and helping out from a distance. But it was just my husband, my mom helping out by keeping my first son. But it was just really me and my husband and the doctor.
Oh. Janine, what about you?
Levels of support. Just like Laura, first was my husband. He was really close. We were able to actually, because we were doing private clinic visits, he was able to be there. And also my first son, he was able to be at the doctor visits with me, and they were able to be a part of that initial process. I also had the support of my work colleagues and my boss, that anytime I felt any sense of uneasiness or I wanted to question something or get any sort of advice, they were always there to lend assistance and really give me the reassurance that I needed. So I'm grateful for their support at that point in time. And I'm also grateful for the levels of support of family and friends. During COVID-19, we had a lot of restrictions, and you really couldn't see family a lot and have persons at your home due to the restrictions. And the day that I did go into labor was actually my first son's birthday. So we did have a little small gathering at home, and I was at peace of mind knowing that even though I had to leave to go to the hospital to be by myself, my family was still supported. And that support kind of carried me throughout the delivery.
Oh, wow. Go ahead, Nikisha. Share with us your levels of support during this process.
Okay, so during the pregnancy, of course, I had support from my husband. Not very anxious, but because I had support from my husband and also from my colleagues. I am a registered midwife, so I have experience in midwifery and training in midwifery. I work at a health center. I attended the clinic there, so I was familiar with the obstetrician who cared for me and right through the pregnancy. And he was the one who actually did the surgery. So I was also familiar with the hospital staff because I worked there for 1 year. So the support was 100%. I cannot complain about the support. I got the support of all my colleagues and of course my family. And in the postpartum period, my mom came to stay with me for a while. So yes, I had support.
No, I think it's so important to highlight that the necessity of support, even pre-pandemic, and even more so in this time. And something that Janine shared as well, with her workplace and colleagues understanding. And of course, it's because of your area as well. But I think that is such an important point as well, because sometimes in your workplace they may not understand the challenges that you go through during this process, and that could be in itself a stressor for the process. So it's so important that you really do get the support from each and every person that you spoke of. So just to move on to the second section in terms of the birthing process. So I know some of you moms shared that you would have went through pregnancy and birthing pre-pandemic and post-pandemic as well. So if you could give a little bit more in terms of how the birthing experience during the pandemic differ from your experience prior to the pandemic. So Laura, you can go first.
No problem. Okay, so prior to the pandemic, as I said before, I planned for a natural birth. So I had my suitcase and everything packed, and the doctor told me when she felt that I would be ready, so to get ready. And then when I went into labor, went to the hospital, then my mom, my dad, my aunt, a lot of people came, and but they waited outside, and then I went through the whole process, and my husband was there throughout the entire process until they told him, well, it's emergency, so you can't come into the room. We'll take the baby and then you can see the baby. So everybody was there. He got to see the baby firsthand and everything. And of course, I got all the visitation. He could have stayed as long as he wanted to, up until a certain point in the evening. So he would come, go, bring me whatever I wanted for the time period that I remained at the hospital. So my recovery, just coming out from under surgery, was not as stressful. While during the pandemic, that's a total different scenario. First of all, the hospital was different, and it's our newer hospital, so I wasn't familiar with the place at all. So that was my first time getting into there. And then, of course, we had to find what floor. So you're in that kind of situation where they're sending you here and then you're going over there. And then we realized, hey, they're only allowing 2 visits for the day. 15 minutes is the maximum amount of time one person can come to see you. That's it. And going through the first experience with the C-section and the pain and everything that goes with it, and you still have to care for your baby, nurse your baby, and knowing that I wouldn't have my family there, anybody there for more than 15 minutes, that in itself was scary. However, the doctor and the nurses, they were very nice. They really supported me. They really cared for me, so I didn't feel like I was all alone at any point in time. But just the fact that you couldn't get anybody to come and see you, because I have a lot of family living in the area around the hospital, and ordinarily all of them would have come over. And then it was just either my husband would come, or my dad alone could come in, or my mom, and they had to announce themselves. So that was what was different. But in terms of the care and everything from the hospital staff, I must say they did very well. So that was a A+ for me. Yeah.
Oh, thank you for sharing that. So Janine, would you say you had a similar experience?
I would say I had a similar experience, but what I would add is, so both of my children were born preterm. So I would have had to experience the NICU, postpartum NICU experience. And that was really different in terms of, with my first son, pre-pandemic, we had limited hours to go and visit him. I could have breastfed, we could have done kangaroo care, and you had a lot of interaction with the doctors and stuff on the floor to explain a lot about what was happening and how baby's progress and stuff was. With my second birth, I had a emergency C-section at 29 weeks pregnant. And the NICU process then was much more difficult, where the visiting time was shorter. It was about half an hour at the point in time. And you only went in really to get updates from the doctors. There was no really, sanitization process was very strict. Every room you went in, you had to wash your hands, you had to kind of sanitize yourself, and couldn't really interact with the baby as much, to try and touch them, to let them know that you're there. It was really, really quick. And we did that for about 7 weeks. So I really willed myself, because with C-section, it's really painful. The recovery is really hard. The first day I wasn't able to walk to go and see him. So I really leaned on my partner to, you could go ahead, please bring back the information, let me know how he's doing. And even visiting for us was about an hour. And the hour starts from when you get to the hospital door. So the amount of time it takes for you to get to the floor where you are, 15 minutes in that hour is gone. So really, by the time he gets there, we spend about half an hour before the bell rings and you have to leave again. So that was a shocker, and it was really something hard to deal with, because to really liaise with the doctors was by phone. Your partner had to call the ward to find out how you're doing, or we have to call the NICU doctors to find out if the baby okay, what the baby needs, etc. So that was a big difference for us.
Wow, that's all I could say. I'll probably share my thoughts after Nikisha shares. So Nikisha, can you tell us a little bit about how it differed for you?
Well, for me, the main difference was the amount of persons who could visit, because with my first pregnancy, pre-COVID, I was visited by all my family, church family, colleagues, everyone could come in and visit. But with this one, because of the pandemic, it was minimized. So it was, well, the colleagues that I had who worked on the hospital compound, yes, they could visit, and my husband and my mother, but that was the main difference.
Well, thank you so much, ladies. Just listening to your stories, as a mom myself, gets me emotional. So I want to know now, what were so you talked us through the process itself, but if you could give a little bit more in terms of the fears and the worries that you had going through, knowing that you had to go through this process, and what did you really use to help you deal with that?
Okay, well, my fear, obviously, the first was, please God, don't let me have COVID. Because in speaking to my first doctor in one of my visits, while she was doing my ultrasound and we were just talking casually, and she said she just had a patient who was supposed to go into surgery, and then they tested her and she was positive, and they had to send her to the original hospital we had, which we turned into a respiratory hospital. And apparently they did not suit it for delivery or C-section. So it's like she told me they had to call wherever, bring in the beds, do this, do that. And I'm like, I hope this does not happen to me, because this sounds very scary what you're telling me. And obviously and of course the whole process, she said, is just crazy, because they would not want to open you up and you have COVID. Obviously you're putting everybody at risk, so they would have had to isolate you into this specific ward in that particular hospital. So my fear was, Lord, please, 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 please don't let me have this. And so I really kept myself towards the ending of the pregnancy, like the month before. I stayed away from a lot of people. I worked a lot from home to just try to avoid everyone. But of course, my husband teaches at a high school, so he can get exposed. my little one is at preschool, so he could get exposed. So I was just praying that that did not affect me in any way, and I was thankful that it did not. But that was my greatest fear. And of course, um, the surgery, I did the epidural, so I was awake. The doctor told me that I would be. So I had the fear of that because I had never experienced going into surgery and being aware of what was happening around me. And yes, exactly what I feared, just myself panicking, that kind of did happen during the whole experience. But so it was that coupled with having COVID and then knowing that I would not have all the support that I had during the first pregnancy. Um, at this pregnancy, it was just a little bit scary. And what happened was in my first pregnancy, every single appointment that I had with my doctor, I was able to meet. In this pregnancy, towards the ending, I missed a couple of appointments because the doctor had to be called away to emergencies. A lot of persons were sick, so they had a lot of short staff. So she could not see me the way I was seen for the first pregnancy. And so I'm thinking, I hope everything is okay with the baby. I hope I'm okay. I hope the baby is all right. Um, and then towards the ending, like the week before I went into the hospital, then when I realized, hey, I'm not seeing the doctor, what's happening? The doctor is the one that's supposed to admit me to the hospital, give me my papers. And I remember the secretary calling me and saying, is next week okay? And I told her, no, next week is not okay because that's the week I'm supposed to go into the hospital. So you would have to fit me in however you could, please, please, please. And so they had to try to move around the doctor's schedule just to accommodate me. So all of those things, it's a lot to take in. It was scary, honestly, for that. But what helped me out is, of course, the support of my family. My work colleagues also were there on the phone, just giving me the support I needed, and a lot of prayer, a lot of prayer. And from just a mental perspective, I watch a lot of Netflix. I listen to a lot of gospel music and just did things with my first son. We like to do a lot of craft. So I did a few things just to keep my mind off of it because I had a relatively normal pregnancy. I wasn't like on bed rest or anything like that. I was moving around normally. So we would just do the little things that we could in my condition and just to have fun to keep my mind off of it. So that's how I coped.
Yeah, thank you, Laura. So Janine, tell us your experience.
I think because of the experience I had first, when I got pregnant again, it was planned. So when I got pregnant again, I knew a lot of the risks that I had to deal with going into my second pregnancy, especially probably looking forward to another preterm birth. One of the things I tried a lot was a lot of self-talk. And I really, really mentally prepared myself because I knew what the possibilities could have been. A lot of self-talk. The only time I think I experienced fear was getting to the hospital. I mean, I knew I was in preterm labor. I got the signs. I tried to fight it a lot, but when I got to the hospital, I was told that baby was in a bit of distress and I was going into sepsis. Then I was like, okay, this is a bit serious. And being told that I was going to have an emergency C-section versus having spontaneous vaginal birth the first time. So it was a bit different. Even then, I tried to not panic, but at least ask the questions as, what is the procedure like? How long is it going to take? What am I going to do? What are the risks? Is there anything else I could do? What would be the outcome? They had to move really quickly. So within 10 minutes, I was already in gown and in theater going into the surgery. So it was really fast. But the doctor, he did explain a lot. The nurses explained a lot. Every question I asked, they had the answer to. So that was really helpful in terms of trying to calm me down and calm my fears. So going into it was not as, I was not feeling as panicked or stressed about the situation.
Thanks, Janine. Nikisha?
Okay, so throughout the pregnancy, especially going into the third trimester, I was a little anxious about contracting COVID. I work 5 days a week. I have to see my clients face to face. I'm examining clients. So you are out there, you're exposed. So I was just a little concerned, but of course, prayer helped me to get through this. I prayed, God, please do not let me contract COVID now, especially when I'd have to go into the hospital, go on the isolation wards and all of that excitement. I wanted to skip that. I also got a little anxious when I realized that I was going to do a C-section as opposed to a normal vaginal delivery. But prayer is what really got me through. And I remember the Bible says, be anxious for nothing but through prayer and supplication with thanksgiving. Let your request be known to God, right? So I held strong to that, and I asked my church family really prayed for me, my mother-in-law, my mother, we are prayer persons, so we really prayed. And I can tell you, I was anxious about getting the epidural as well, because being awake throughout that experience, I asked the anesthetist when he came in to speak with me, I am worried about having an anxiety attack during the surgery because from experience, I do not like being in the theater. I do not like seeing what happens there. I know what is going to happen there. As much as you're going to block that from me, I know what's going to happen down there. So I was a little anxious about that. But he spoke with me and he kind of allayed my fears. By the time he finished speaking to me, I was getting a call from a church sister. I could not accept the call at that time. After I finished speaking with him, he left, and the midwife was preparing me for theater. The church sister left a voice note on my phone. So during the preparation for theater, I listened to that prayer that she prayed, and she prayed, and that prayer alone just calmed my fears. When I went into the theater, they say that fear, that calm, that surpasseth all understanding, that was the calm that was over me during the time that I was in the theater. So thanks be to God, I got through that. So the support that I really got was family and my church family, prayers. I cannot stop stressing on the prayers because that was what I held strong to. Yes, that was it.
No, thank you, ladies. I love that. You all are very amazing for, it's like similar veins, but then still slightly different challenges. But I love that you all were able to get certain things, be aware of it, and use what you know could help you to really go through it. So now I just want to ask you in terms of, so now it's after the birthing period, and you have your baby now. What is that like? What is the postpartum experience in a pandemic? What is the support levels? How did you all deal with that?
Okay, so for my first, when I had my first son, my husband came to every single appointment. So every vaccination, anything, he was right next to me. Especially, after having a C-section, you cannot carry yourself around the way you would normally do it. So you need help. So he would be there with me. So now for the second baby, I have my 5-year-old, my husband, myself, and the baby. For the first few visits, we had to go to the hospital so that they could examine the baby. And what I observed, of course, was that what I'm used to seeing is a lot of chairs and you could sit down anywhere you want to, but this time it was sectioned out. So you would have like just a few places you could sit. So I would be able to sit, but my 5-year-old can't sit because I have the baby. So it was a little inconveniencing, a little uncomfortable. I was thankful that I had a car because sometimes they would ask you to wait in your vehicle or you would have to wait outside before they allow you to come in. And I'm thinking, what about all the parents or the mothers who do not have vehicles and the sun is hot or it's raining? Where do they expect them to stay? If they only have 3 chairs and 20 persons waiting, you have mothers who have to stand with their babies. So it was a bit, it's just not nice. And then you don't want to come to your appointment too late so that you don't get a seat. So sometimes you come in very early and then you still have to wait. And then you have the whole scare about you don't want the baby exposed to too many people. So you're trying to protect the baby, you're trying to protect yourself. And of course, the cost of everything, if you're doing private, goes up. If you're not doing private and then you're getting free, but then you have a lot of persons, so the exposure it increases exponentially. So I tried the free and the free healthcare, and after I was like, no, because the care they take in the private doctor's office is not what they do in the public. So it was just, and it was a longer wait in the public. And I had gestational diabetes, so coming out from under surgery and everything, you still had to check your blood sugar and make sure everything was okay. And I remember one of the visits, because I waited so long, my blood sugar had gone almost to a scary low. And they had to give me something, told me to go and eat something with sugar to bring it up. But I didn't have any of these experiences for my first son. It was just go to the doctor, get what I needed, and I could have waited with whoever was there to help me out. But the second time around, you had to come when they told you to come, wait where they asked you to wait until they would be ready for you. So that was a difference. And again, it's similar. It's just my mom, dad, and my husband were the persons that were in my circle to really assist me so that I would avoid exposure to the baby or any viruses and that sort of thing. So that was my experience, or that is my experience still
Right.
at this point. Yes.
True. Okay, Janine, what about you?
Um, the levels of support the second time around was really hard. I think my second postpartum journey, I had to deal a lot with my emotional and mental health because of the restrictions. I spent a lot of time alone. We didn't really have the opportunity to have family around. There was nobody coming to bring gifts and food and laugh and talk and all the things I had my first time with my first son. Also having to go to the hospital to do visits in the NICU. I went every single day for 7 weeks, and then he had outpatient clinic for at least 2 months after. How my husband works, sometimes he was not at home for a period, so then I had a toddler and a newborn, and I have to do clinic. So I did a lot of up and down after having a C-section. So like I said, I really willed myself throughout the pain to kind of be able to do the things that I did. It took a toll on my body physically also, as I was not eating properly. I was not taking care of myself properly. So breastfeeding became difficult. I had a lot of moments where I was sad, or times where I would just be alone, and all the thoughts of I'm home and I'm looking at an empty crib and my son is in the NICU and I want him home and I want to be hugging him up. So the postpartum period and that support was missing a lot. I mean, I had family that would call, but as much as they call and they try to cheer up for moments, then you have the rest of the day to try and be there for yourself. So it was really an up and down challenge trying to go through that postpartum period and having that support.
Oh, thank you for sharing, Janine. Nikisha, you can go ahead and share.
Okay, well, my postpartum period was not affected as much, except that because of COVID and restrictions and stuff, I did not spend a lot of time in hospital. After my C-section, I went home like 2 days. But at home, I got the support needed because, as I said, my husband and my mother. So my mother left her home and came and spent time with me. So yes, I had that support in the postpartum period. And going out to clinic, well, so far I had one clinic visit because my baby is only 8 weeks old. So when I went to my clinic visit, it was not hassling for me, honestly, but that is because of I am a staff member of the clinic that I attend. So you know that they take care, we take care of our staff. But I can tell you for others who are not staff members, yes, it can be a bit tedious, especially with the spacing. You don't have enough chairs to sit, you're coming up with a baby bag. Usually you would have a chair, you can put your bag on the chair. That is no longer available. You have to have your baby in your hand and your bag in your hand, or put the bag on the floor. You can't take your whole family with you as you would normally do because of the spacing issues and also the crowding, especially at our public facilities. So yes, it is an issue, but as I said, that was not a real issue for me personally.
Well, thank you so much, ladies, for sharing so openly and vulnerably. I think these are things that we need to be talking about so that we are aware, because some of the things that you all said that kind of helped you process was, being informed, being familiar with the doctors, the hospitals, or or where you're giving birth, having support, and even the new things that Janine, you talked about, being able to have the tools to help you mentally, emotionally, and Nikisha, even spiritually. Those things are so important in these times. So I want to thank you so much for sharing with us and for the placements here. I'm sure it was a very insightful and eye-opening, but it was for me, and I'm sure it is for the audience as well. And so now we're going to hand it over to Miss Deborah Lewis, who is a midwife and executive director at Mama Toto Birthing Center. So she's going to share some tips and strategies around navigating pregnancy, birthing, and the postpartum experience during a pandemic. So thank you again, ladies, and you can take it away, Deborah.
Okay, thank you so much, Yashi, and thank you for the opportunity. I'm going to just open the presentation. Sorry, I can't see the top. Oh. Okay. Now let me just move everyone because you blocked. Okay, thank you. So thank you again. So, I mean, we were able to hear actual experiences. So now I'm going to just really briefly share some tips because, although the situation is getting better, I think the restrictions and the challenges remain, particularly in this region, in the Caribbean. So the first thing that I wanted to talk about was your overall health. So just the best defense, I think, really is keeping yourself as healthy as possible. Keep taking care of your immune system, making sure that you have healthy, balanced meals. We have lots of fresh fruits and vegetables in this region, lots of water intake, make sure you're taking your supplements. And of course, the stuff in the middle about the face mask, I don't think we have to talk about that. We've heard it nonstop for over 2 years. So just the gist of it is just really do what is necessary to keep yourself healthy so that your immune system is in good condition. Now, during the pregnancy, make sure you're getting your information from credible sources. So the World Health Organization, UNICEF, the CDC, your care provider. Do not, read all these stories that are going around that, really share a lot of misinformation sometimes and can only add to the anxiety that you already feel. Avoid exposure. Nikisha spoke about that. So don't go out unnecessarily. We don't want you to feel like a prisoner at home, but just to be conscious of it. For example, if you have to go to the supermarket, go, but try to go on the off hours, when it's not at its busiest, so that there are not that many people around. So just generally try to limit the contact. Get tested. Now, this seems odd, but what we have found is that there are a lot of pregnant women that are afraid of getting tested when they have mild symptoms. Either they don't want to know, they're denying what they're feeling. It is very important for you to get tested so that you do know. If the symptoms get worse, you may need to be hospitalized, so early care is better. But even if you have mild symptoms throughout, it is still important to know whether you are positive or not, because in fact, it can have an impact on your health and the baby's health, depending on what trimester of the pregnancy you are positive. So please get tested. And then in terms of the visits, as I think all of the panelists mentioned, that the visits they've changed. Some of them went to telehealth, etc. In this region, what we found is that they limited the numbers of people that were allowed at the visit. So whereas pre-pandemic, you were allowed to have someone with you, maybe even more than one person. If you had a child before, that child would be allowed to come to the visit. That has stopped. Almost everywhere, you can have maybe one person. In most places, no one. In one situation, they will ask the accompanying person to wait in the car and only come in when they're in the examination room and so on. So it adds a little level of stress. What we have found works really well is you come to the visit alone if that's what you have to do, but use a video call. You have FaceTime, you have WhatsApp video. Everybody has something on their phone where they can do a video call. So do a video call. Even more people can join than would normally be able to accompany you physically. The children can join, they can hear the baby's heartbeat, the joy on this father's face in the picture, when they hear the baby's heartbeat. So start a video call. It does not have to be for the entire visit, so you can have your discussions first. But then when you go into the exam room where you palpate the stomach and listen to the baby's heartbeat and so on, have a video call and let the whole family be on the other end so they can still feel as if they're a part of it. In the labor and birth, I think, Yashi, you talked about the preparation. It's so important to be prepared. You have to have an idea of what to expect. And if that information comes from your care provider or from going to childbirth classes, it's really important to have a sense of what is happening, to understand what is happening, to be able, for example, to time your contractions, to understand what stage of labor you're in, so that the second point, you will know when to go to the hospital. You absolutely do not want to go to the hospital too early. Again, one of the panelists mentioned, the longer you're there, the more exposed you are. So if you can stay home and be with your family and then go to the hospital when it's appropriate, not to wait too long, but if you have the knowledge, you'll be able to time it well to understand what's happening and when to go to the hospital. Also because the third point, respectful care, has been almost non-existent since the pandemic globally, but in some countries they've lobbied to really change that. However, in this region, it has ranged, as you heard, from no visitor to one visitor, half an hour a day, once a day. There's one of our largest hospitals currently in Trinidad and Tobago where you're not even allowed to have any visitors at all. So you're admitted in labor, absolutely no visitors until you're discharged to go home. So that takes us to my next point, the early discharge. It is possible quite often that you can request an early discharge. They will have a minimum amount of time that you have to stay. It might be 24 hours, but there are some hospitals that will discharge you early. Once everything is normal, once everything is safe, that you can be discharged and go back home to your family earlier. It doesn't hurt to ask. So these are things, a question that you can ask. And if you are able to go home early, great, because then you're back home with your family and all the support that comes with that. And then postpartum. Well, again, avoid the exposure, as we talked about earlier. But the part about this that you have to be really careful with, that we have discovered, is the people who come to visit you. You know, they say that a lot of the transmission comes from familiar people. So people that perhaps you feel comfortable not wearing a mask and you take a risk. What we have found here is that a lot of the families are testing positive in the postpartum period because of visitors that have come. So we really advise you to limit the number of people that come to see you. And if, of course, there are going to be some people that you really want to come, so take precautions. Don't let them hold the baby. Make sure they wear a mask while they're there. The general precautions that you would take, amp it up a little bit during this postpartum period. The breastfeeding I put in because, of course, it gives babies the best defense in terms of building their immune system. So a good thing to consider. The visits, again, I think it was Laura really that spoke about the visits and how limited they were prenatally during the pregnancy. And also that carries over into the postpartum area. Oh goodness, I'm sorry, into the postpartum area. So the visits are less. And again, quite often when you go for the visits, you're alone. When you take the children for visits, same thing. One parent is allowed, the other parent is not allowed. So same thing, video calls to include everybody. And I put telehealth here because I found that if you can find a pediatric provider, so a doctor to care for the baby or a clinic to care for the baby that will consider doing telehealth visits, it's great because sometimes it's a rash or something that you notice about the baby that may not need an in-person visit. So you can do, again, a video call. The provider can look at it, recommend what you can use or what can be done. So, you know, explore that. We've had great success with one particular provider who really does a lot of telehealth, and it's been absolutely safe when it's done, you know, well. So consider that. And then the last thing that I want to end with is self-care, because I don't know, Janine, everybody referred to it, but Janine captured it well. There are already so many stresses during the pandemic. People are working from home, the restrictions that we've been put under, their homeschooling, you know, just really a lot of emotional and psychological stress. And then you add to that the hormonal fluctuations of pregnancy and postpartum. And in addition, postpartum, the lack of sleep, because babies do not sleep through the night. So it can really affect your mental health. And this is often not addressed in routine care, in routine postpartum care, because after all, it's supposed to be like a celebratory period, you know, and nobody really wants to focus or acknowledge on the challenges and the anxiety and that sense of just being really overwhelmed that you can feel in that period. So some of the things that you can do, of course, in the beginning, I talked about, you know, eating and drinking and all of that. Well, but in addition, the mindfulness. So mindfulness could be something like very light exercise, taking a walk, doing yoga, praying. That worked really well for Nikisha, or even just simple breathing exercises. So just taking a moment to take a couple deep breaths in and out and just really letting go and relaxing. It absolutely helps. Stay social. Now, what do I mean? I just told you not to be around a lot of people, right? So you can physically isolate, but you do not have to isolate from human contact. So call people, talk to people, have group calls, whatever that looks like for you, but maintain that human connection so that you have some sort of social interactions. It does not have to be in person. And networking. There are quite a number of community groups. There are a lot of online support groups and forums where you can seek support. You know, there are mother support groups, family support groups. So really identify what you need and research it for your community, your country, because there are several things that exist. And please, please reach out. Reach out when you need help. Ask for help. That help can come from your family, from friends, from your community. Nikisha said her church community. Laura had lots of family. Janine had family even at her son's birthday party. But you must identify the help and ask for it. Ask for it. It's okay to ask for help. And that help can even be from a professional. It's okay. If you feel as if you need some sort of counseling, it's okay. It's fine. You have to be able to be comfortable asking for the help, whatever you identify that you need. I put relationship in there because with your partner, or even if not with your partner, with whoever you identify that you have a strong relationship with. And it's important to maintain that relationship. So quite often people become totally focused on the baby. The baby is a 24/7. Yes, you love your baby. It does not mean that you love that baby any less if you also give a small percentage to other things that are important to you. And the last thing that I want to say is absolutely do not feel guilty for doing self-care. You do not have to be a superhero. Your mental health is important, particularly during the pandemic. Please be kind to yourself. Take care of yourself. If you take care of yourself, then you're in a much better place to be able to take care of your baby. Thank you.
Well, thank you so much, Deborah. I absolutely love those tips and strategies, especially last few you just shared, because, and this is me even, I didn't go through a pregnancy during the pandemic, but knowing that guilt that you have and feeling like you have to go at it alone. I don't know what is this thing in culture where they feel like women and moms need to be, you know, this, as you said, a superwoman. And it's really not that. It takes a village. It takes you having the support. It takes you asking for the help, being aware, everything you said. So I just want to endorse that 100%. And I'm sure the ladies do as well. So I want to thank you so much for sharing that information with us. And we just want to open it up right now for a Q&A session with the ladies and with Deborah, of course, as well. So ladies, please put your questions in the chat. And while they're doing that, I just wanted to ask one more thing of the ladies, and Deborah, you could chime in as well. If you have any other words, resources or words of advice that you would like to share for women who are planning or people who are planning a pregnancy or who are currently pregnant. I know Megan said she wished she had the information before, but it's okay, Megan, you have it now. Anybody could go if you have anything.
All right, so I'll take first chair. What advice I would really give moms that are pregnant now that are going to give birth in the pandemic is really to prepare. Preparation is key. That is what will bring along the change and bring along you having that birth experience that you really want. Prepare, write your birth plan. I mean, all of us spoke about our birth plans and it really did not go to plan, but have preferences, make choices, ask questions, and really dive into, because you plan what you want to eat in the morning, you like certain things. We all have things that we would plan for, so we should use the same tools for our pregnancy and our birth. Really, the childbirth classes are also something that's a really helpful tool to help you get prepared, whether you are, if you know that you're going to be, if your partner is going to be in the delivery room with you or not, but it just helps you all prepare for what is to come and how to really hold it together through the birthing process. And also trust yourself. As much as we do hire our care providers to take care of us and all of these nice things, really trust yourself that you can go through the process and you could do everything that you have to do, because we are really, really strong and we could do some unspeakable things. So that's really my advice for everybody.
Thanks, Janine.
And
I'll
I
go
also
next.
want to add, so I just wanted to add to what Janine said, and don't be afraid to ask questions, you know, in keeping with what Janine said. Your care provider is there to care for you. So go prepared with questions that you have. If you have to write them down, do that. But ask questions, and if you feel like you're not getting satisfactory answers, keep asking again until you understand the language they're using, understand what they're saying. It's okay, you have a right to that. Thanks, Yashi.
Thanks, Deborah. I think Nikisha is going to share something.
Oh, yes. I'm just going to repeat, be prepared. Pregnancy in itself is a stressing process on the body. Make sure you keep your immune system up. Make sure you protect yourself, so you sanitize and you wear a mask. I can tell you from experience that it is very difficult wearing the mask, because I had issues breathing with the mask in my third trimester. So what I had to do is wear a face mask instead and use the mask over my mouth only. So the face mask will protect my nose, but you have to do whatever it is necessary. You know that you're in a situation where you have to, for myself, I had to see clients. In between my clients, I have my little space where I remove my face shield and mask and actually get some fresh air, right? But you have to ensure that you take these things into consideration, that you cannot put yourself at risk. And of course, pray. Yes, those are my few words.
I have some few words. I'm driving, that's why my camera is on. Good night, everybody. My name is Tanya. I joined in a little bit later because of my.
Sorry, I missed your name. What is it?
What you're writing, what to give birth in, try to find that out, early, because we can give birth in other positions besides your back. So definitely know you're right. Advocate for yourself, speak up for yourself, and of course, always affirm yourself, because your body's going to do what it's going to do when it needs to. So definitely affirm yourself, and of course, know your rights and advocate for yourself.
No, thank you for that. So just to address some of the questions in the chat, I saw, I hope I'm pronouncing your name right, Kiara asked if you know of which businesses offer telehealth telehealth?
I'm not sure what country she's in, so it would be a little bit of a challenge to answer. But if you are considering a provider, then call and ask them. You know, it varies. Some businesses are more comfortable doing it than others, but you would have to call them. You're in Trinidad, okay. So if you give us a call at Mama Toto, I can get a little bit more detail if it's a pediatrician, obstetrician, or whatever, and we could talk about it. So you could give us a call, and Kiara and we can talk about it.
Okay, great. Thanks, Deborah. So Megan also asked if there are any tips on how to enjoy your pregnancy.
I'm going to leave that for the ladies who are pregnant to answer.
I'm gonna let me try with that one. Self-care, spend time with yourself, take pictures, dress up, go out. You don't have to go out into crowded areas. Go try for persons who are in the Caribbean, you know, you try a private beach where you can go with just your family and you take pictures and you enjoy the day. Try to relax and include the rest of your family in the pregnancy and take a lot of pictures. Yes, that is how I enjoyed my pregnancy.
Yeah. Okay, thank you for that. And I want to say that I actually do like that question in a sense, because I think persons are afraid to say sometimes that they're not enjoying the experience, and that is a reality that could happen sometimes, right? So it's I actually like that she asked that question. So let's see. Dana asked preference between private and public delivery. She's heard horror stories about birthing in public in Trinidad versus persons telling you save that 30,000 private charges and go public, you'll be fine. Has anyone had experience with both?
I have. Well, I'm in St. Lucia, so I don't know how it is in Trinidad. I did both. So the first time I did it in private, paid a lot of money. And second time around, I paid virtually nothing. I did hear horror stories. What I tried to do was, I think as Deborah said, be properly informed. And if you see that you're listening to the news or you're reading up on social media and you're hearing a lot of negativity, stay away from it. Because the situations may have been isolated to something you're not getting the whole picture, you don't know everything that happened. And especially if it pertains to babies and you're just hearing all this negativity, block it out. Stay away from it. And just be positive, because you can do this. You will do it. The baby is not going to stay in you forever, so it has to come out somehow. So, and that's what I kept on telling myself: you're not going to be pregnant forever. You have to do this, and you can do it, and you will do it. Your grandmother did it with 10, 12 of them, had the babies at home, and they survived. My grandmother told me so many stories, and I was like, my grandfather told me that 4 of his kids were delivered in his hands because the midwife was 2 hours away. So he watched what happened before and did it, and then went to get the midwife after. So when I heard all of that, my grandma gave me that courage I needed. And I said, okay, it's not that bad. So you can do it, but just stay away from the negativity. That helped me a lot. Just block it out and stay with the positive.
Thanks, Laura. And Janine, did you want to share something on that as well?
No, really, Laura captured it. Everybody's experience is different, and that does not mean that that will be your experience. So really be informed, advocate for yourself, and prepare for it.
Let me just add, both institutions had very well trained nurses. They were very nice. When I came out of both sets, I asked But what is all the complaining about? I heard a lot of complaining from a lot of different people. And the doctor did say to me, it all depends on how you react or you behave towards them, that they will respond to you. So if you come in with all your attitude, yes, you're in pain. But if you come in with all the attitude because you already have those negative thoughts in your mind that they will treat you a certain way, so you're already beginning to behave that way, you're going to get the same treatment in return. But if you come there humbly, this is not your territory. This is theirs. They know how everything is supposed to be because they have the experience. You allow them to tell you what to do. You express yourself, you say what you don't feel comfortable with, but you don't go like you're the king of the jungle and don't expect that you wouldn't get a negative response. So my doctor also, because she is the head of the unit, she did tell me that these are some of the things that happen, and just be calm and just, yes, you're in pain, so yes, they expect all the pain, but the negativity and the calling of the names and treating people like they don't matter, don't do that. Don't do that. Um, they will be professional, they're trained to be professional, and I experienced it from both ends, and it was fine either way. I had a good experience. I don't know what somebody else will have, but I'm just telling you that I came in with the knowledge that, hey, I'm coming with a blank slate. Whatever has to happen will happen. I cannot control my circumstances, but I can control how I behave, what I do. And I think that's what you need to do.
Again, thank you so much, ladies, for everything that you've shared tonight. Of course, in the meantime, if you could pop your contact or how they could reach out to you in the chat, if anybody wants to as well. And I'm going to pass it straight back on to Khalida and Aaliyah to close us off.
Thank you so much for this. This is such a great conversation. And thank you so much to our panelists, to Deborah for her presentation, and for Yashi for moderating. This is really great. Thank you to all of our participants for joining us. This is really great. We were going to put a link in the chat for that has like a website so that you can be able to fill out some answer some questions about what you thought about the webinar. We're really looking forward to hearing from you and hopefully having more events in the future. We will also share through email some of the resources that Deborah has shared with us as well. So thank you all for joining us, and have a great evening, everybody. This is really great. Thank you so much.
Okay, thanks everyone. Bye-bye.